Hello and welcome back to 90 Seconds Healthcare with you, Dr. Samer Ellahham, cardiologist. I recorded a brief video on the health impact of smoking and the harm that it causes. Very importantly, to follow the video with what are some tips regarding smoking cessation. For my colleagues and my dear respected ladies and gentlemen who smoke, you could have said, I already heard a lot about smoking cessation. It's not going to be easy to do it, etc. I have kind of 10 tips on smoking cessation, and I do hope that you'll find those helpful. And I will start with the first tip. The first tip sounds like it's very obvious, but patients tell me that it's very, very important. Set up a quit date. So number one is to set up a quit date. And what I mean by that is choose a specific date to quit smoking and please commit to it. And don't change it. An anniversary, a birthday, a holiday, 1 day per week, the weekend, that is going to be your decision for obvious reasons. The second thing is seek support. I don't mean only support from the healthcare system. I don't mean support from the healthcare provider, the physician or like. I mean from friends, family, and anyone that you think will provide you with the appropriate support. The encouragement of these individuals, including the healthcare providers, trust me, is invaluable. So that's the second one. The third one is key. Identify triggers. The idea is to figure out, a situation, an emotion, or perhaps activities that make you want to smoke. What makes the person want to smoke? And ideally, have some sort of a strategy, some sort of an approach to avoid or cope with these triggers. I mean, if you cannot get rid of them altogether, you can cope with them, and that has to be gradual for obvious reasons. Number four, and again, going over these simple tips that I find or the patients find to be very valuable, is plan alternatives. Find some healthier alternatives to smoking. So this could be chewing gum. This should be maybe snacking. You could be doing some activities, wherever helps you, deal with some craving. We call it craving strike when it happens. Number five, specifically, since nicotine is the most addictive substance in smoking, nicotine replacement therapy could be very helpful with many individuals. So you consider different forms of nicotine replacement. You can take the gum, you can have the patches, or even the lozenges. The idea behind it is you are trying to manage your withdrawal symptoms. So again, this is helpful nicotine replacement therapy. Number five. Number six, find some distractions. And some of these things are somehow related. Keep yourself busy with activities that might divert your attention away from the smoking. So, hobbies, whatever your hobby is, spend time, with non-smoking friends, go to non-smoking areas, or ideally exercise. Because exercise not only will help you, with smoking and stay away from smoking, but exercise by itself has a huge benefit on your heart and in your whole health, even your emotional health and mental health. Number seven, change your routines. Some patients tell me that after I eat, I immediately want to smoke. That doesn't mean that you shouldn't eat, but that means that, maybe change the habit of smoking, eating and smoking. And, these have to be individualized. There is no one, solution that fits all. You have to individualize these, and it's your decision how to address these. I'm only giving you tips, and I do hope from the bottom of my heart and mind that these are helpful. Number eight, and this applies to anything in life, not only smoking cessation, applies to you and me and all of us. Stay positive on anything and everything, including quitting smoking. Quitting smoking can be quite challenging. And these things if you tried before. I've never smoked, but I can imagine, and from what I hear from colleagues and smoking patients, that it is challenging. But maintaining a positive attitude, a positive mindset is quite crucial. One way is to remind yourself of the benefits of quitting smoking and celebrate each and every smoke-free day. Even celebrate if you are smoking less than before. That is worth celebrating. 9, avoid the temptation. So stay away from situations or environment where you're likely to be tempted to smoke, such as typically smoking areas, as you can imagine, and smoking friends. And then 10, stay persistent. It's all about persistent. And that's not only true about smoking. It's true about how to manage diabetes, hypertension, hyperlipidemia, and everything, anything in life, even at work, even in personal life, etc. If you slip up and have a cigarette, don't be discouraged. Don't feel like that's it. I did it. I'm not going to do it anymore. I'm going to go back to smoking. I cannot do it. Wrong. Please continue to be persistent. Use it as a learning experience. And, I'm also involved in so many things in quality and improvement. Why not use it as a step towards improvement, even if it's a minor setback? And recommit to the quit plan. Remember, quitting is a process and it takes multiple attempts. I know individuals who tried to quit smoking 3 times, then succeeded, 5 times, believe it or not, 10 times. It is very important note that quitting smoking may require sometime professional help or physician help. That's fine. Wherever you are, that's okay. You can consult a healthcare provider for a personalized advice and support. But the most important thing is it is doable. When you quit smoking, the benefit is clear within the first 4 weeks, 3 months, 6 months, 1 year. It goes on. With you was Tamer Ellahham, cardiologist, discussing quitting smoking. We're all positive. We want you to be safe. We want you to be happy. We want you to be healthy. Have an amazing day. Thank you.